Today we're going to be inserting and removing a Foley catheter from a female. Where you would go ahead and first check the patient's chart, make sure there is an order. You would then go ahead and perform hand hygiene. Then identify your patient, checking their wristband and verifying their name and date of birth. All right. Then you want to close the curtains for privacy and then explain to your patient what you're doing. All right, Mrs. Smith, we're going to be inserting a Foley catheter, okay? You may feel a little discomfort. Then you want to go ahead and gather all your supplies and then lift the patient to the appropriate height. Okay, the bed stopped working, so I'm just gonna proceed with the procedure. I would go ahead and pull up, put on some gloves. Take the covers off. All right, and then go ahead and drape the patient here. I would go ahead and drape the patient, putting this under the thighs here. All right, and then I would, before I start, I would perform perineal care. So you do want to make sure that the patient tests the water, make sure it is at an appropriate temperature. You will go ahead and grab your washcloth, making it like a mitt. Holding it. You grab any soap or cleansing solution you have. Because she's a female, we're gonna go work our way out. So one wipe down. Fold in a different direction. Use another fold. Down. Same thing. Get another corner. And you would go down the middle. Okay? Then you would go ahead and rinse and pat dry. So you do the same thing, one side, the other side, and then different corner. And then you would go ahead and pat dry. Then you would go ahead and remove your gloves, perform hand hygiene. Then you want to go ahead and set up your sterile field. So take this out here. I'm going to put this on the side of the bed, just to be more convenient. I'm gonna move all these things over. All right, then we grab our gloves here, outside, cup end towards me, put them in here. Mine does only have the two folds in the middle, so just open there. I would pinch with my non-dominant hand. Gloves on. Put this up here and toss it in the trash. Then I would go ahead and open up a drape go ahead and go under, being sure that I don't touch the patient with my sterile gloves. Open up my neck drape. And I would do the same thing here, just to extend my sterile field. All right, now I'm gonna move my sterile field. So I'm gonna bring it here. All right, so first I don't need this, so I'm gonna toss that. My patient was not allergic to either of the solutions, so I am gonna use the hydrogen peroxide here. So I would throw that one. I would open this and put it on my cotton balls there, toss that, and then I would fluff my cotton balls. All right, put that to the side, open my lubricant, place that there, toss that away. I am then going to, this is for any specimens that I would need. I'm just gonna put that there on the side. I'm gonna go ahead and fill my balloon. Or place the syringe on my balloon. Leave that there. Then I would go ahead and open this. I'm gonna place this in my lubricant. Put that there. And toss that. Then I'm gonna go ahead and open my patient. Once my non-dominant hand touches my patient, I can no longer use that hand until the end of the insertion. So I'm going to go ahead and spread the labia, grab my forceps to clean the perineal. I'm going to go ahead and go on the outer labia, toss that. Outer labia, go from up down, and then third one down the middle. Okay. And then I would toss these here. Then I would go ahead and grab my catheter. Okay. Making sure that it is lubricated. I'm gonna go ahead and insert. I would tell my patient to hold her breath and breathe out. Okay. Okay, feel a little pressure. Alright, perfect. And then once you do get urine draining into the bag, you would then advance the catheter 2 to 3 inches. So once it is in place, you want to go ahead and gently put pressure on the lips to hold the catheter while you inflate your balloon. Then you'll go ahead and remove your syringe, put that on the side, and gently tug for placement. Once it is placed, you will have some kind of a stat lock to go ahead and secure the catheter on the patient's leg. You just give it a little bit of slack and place it here if one was present. At this time, if you had any specimen to collect, you would go ahead and connect the syringe here, taking that directly out from this clean and sterile Foley catheter, placing it in here and sending it off. Then you would go ahead and take the bag and place it on the bed, not to any rail, but to the bed itself, to prevent any pulling or any mishap. Okay. And then you would remove your gloves. And toss those, and then you would perform perineal care for any extra lubricant or anything of that sort, just to clean your patient. Then you would remove all the equipment here. Cover your patient up. And then lower them back down in the secure position. Okay. Then you would go ahead and I'm going to start on the, oh, and also once you've removed your gloves, you would perform hand hygiene. Okay, and then now I'm going to move on to removing the Foley catheter. I'm going to try once again to put the bed up. No, but okay. I'm going to go ahead and check my patient's chart, of course, making sure that there is an order for the catheter removal. I would then perform hand hygiene once again, identifying my patient, checking the wristband, and also verifying their name and date of birth. All right, and then you would close the curtain for privacy and then explain to your patient what we are doing. Mrs. Smith, we're going to be removing your Foley catheter. You are going to feel a little discomfort, okay? Then you would go ahead and put a pad or a chuck on the floor. You would go ahead and drain the bag, noting the amount, present color, and odor, and then documenting that in the chart. Once you have done that, you would go ahead and pull this down. You would go ahead and place the bag on the bed. Of course, the bed will be at level height, which is elbow height. Before you do that, you want to go ahead and put another chuck underneath the patient. Before you put the bag on the bed. Down to your patient. Put the bag on the bed. Here. You would grab your syringe that you had, attach it here to the bag. You would go ahead and remove the leg strap that was present. Of course, so toss that. And now you're just gonna see the syringe fill on its own. It should be the same as what you inflated, which is 10 mils. Before that, I would put on gloves. Now it looks like it is 10 mils. Okay, we would remove. And then you are going to tell your patient to inhale and then blow out on the count of 3, okay? 1, 2, 3. May feel the discomfort. Coil in your hand. Roll up in the chuck. And then dispose of that. You would perform perineal care, going first on the outsides and then down the middle. Rinse and pat dry your patient. Cover them up. Alright. Cover them up, placing them in the lowest position possible in a comfortable position. Remove your gloves and perform hand hygiene. Alright, and that is it.